Can I introduce Dr. Nguyen, who's going to conduct the discussion session now? Thank you very much again, Dr.
Actually, we coming to the discussion and to prepare for that discussion on the priorities of each national malaria control in the last milestone of elimination, that we would like to hear and to explore from each country about your top priorities. And if you have time, then there's a QR code on the paper on your table for discussion one. And if you have time, then please give us the three top priority of your country about in the last milestone of malaria. And there's a QR code. The QR code. And actually, I thought that each country have your unique context and the different top priorities for the last milestone of malaria elimination. And we have some sharing on the screen from each country is about the asymptomatic malaria patients, the financial support for sustainable capacity, and managing the mobile population. And on the other hand, we have from Vietnam that the effective surveillance with parasite and vector, again the asymptomatic and the vector control. And there's some sharing from each country, but we would like to hear from you more about this. Then may I ask for the sharing from the Dr. Sip, please. Actually, directly is more about your top priorities of Cambodia, because we understand that there are very few cases of falciparum and maybe no case in the last few months in Cambodia. And what is your top priorities in to target the elimination in the next coming year?
Okay, thank you very much. When we talking about Cambodia, we talking about last mile elimination. We talking about the last mile PF elimination. We don't want to mix up the two species. It's a quite different strategy. So when we talk, but I don't know in here you mean you last mile here for falciparum or what? Because the priority why we need to conduct last mile elimination of PF malaria. Because falciparum is the one that can parasite that can create a resistance to malaria drug. For PV we don't know yet, but for PF for sure, ACT will be the resistant according to the falciparum parasite. So in order to meet the global initiative for eliminate for all the drug resistant, so we need to eliminate PF malaria. So in principle, in Cambodia, last mile is to eliminate PF malaria. It also consider of to halt drug resistance of the country and also to prevent the spread to the region. So the top priority of the PF elimination, you have to consider of they already list there. Case management, rapid response, vector control, but the important is early diagnose and treatment. So what does mean early mean? It means that every case you need to have a mandate to report to the system within 24 hours. So in Cambodia, more than 99% of case has been reported within 24 hours. This is a mandate. The government has signed a formal rule to everybody, including public, community and private sector. All case need to report to the system within 24 hours. So when the case has been reported to the system in 24 hours, so all the report will be generated automatically by the system, send through SMS, Telegram, or other media, sent to the responsible person to respond. So everybody that respond in that area need to be respond within 3 days. It means that you receive the message today, you have to reconfirm the parasite species, and you need to identify source of transmission, and you need to identify where is the probably the people movement to get transmission there. But this is very important. The one of the top priority is early detection, and after that you can do 137, provide treatment and so on. So in our country, we need to identify what is the source of transmission, whether people transmit in the village, whether people transmit from the forest, or whether people transmit from other area. This is very, very, very important because the different strategy will be applied. Cambodia applied last mile. We can see the local transmission in the village. So we do the MDA, and when we identify of the imported case from the forest, we apply the IPTF, provide prevention to every people before go to the forest. So and when we identify some people from other provinces, we need to extend our support to others province to investigate in that area in order to how to eliminate our source transmission. So this is very important. All here. But one more important, number 3 here, also very important, health education. When you're talking about MDA or TDA, target drug administrative, you will not complete 100% if people don't aware what you want to do it. So health education is very important before you doing the MDA or something. And now one challenge from Cambodia for PF malaria, as I mentioned in earlier, is imported case. We have now this year 90% of PF malaria is come from from abroad. Currently we identify like 25 PF malaria from Central Africa, two is from other. So but very difficult, how can we capture these people? I will have a lot of questions will be asked Martin later when he's present their speech. Because I don't know how our mosquito capacity can transmit African parasite to transmit our local transmission here. So this is very curious because I want to know whether how can we manage it, because mosquito still there, but our country PF nearly zero in some place. So mosquito is clean of parasite falciparum, but we are afraid African parasite coming. So whether they are our mosquitoes have ability to transmit it. So currently we luckily we capture this imported on time. But you know how do you know that these people come from Africa? Because they never tell you. Because people can go, let everybody can go to Thailand and come back. They never tell you I come to Thailand. And they go to Africa the same, they come back, they never tell you I come from Africa. So this is a very challenging how to control the imported case. Sometimes we are a little bit late to detect these people. So when we are late, mean that we provide a chance for local mosquito transmit this parasite. But I'm not sure that our mosquito have ability to transmit this. So still a question in the country. Because last week I has with Gate Foundation John Cox. I also asked him that question. Do you know somebody can help for this? Okay, thank you very much.
Yeah, thanks for your sharing then. Learning from the sharing from Dr. C, that we think that the rapid response for drug resistance and accurate diagnosis and also identify imported cases is really important and the top concern from his sharing. And may I have a follow-up question with the Dr. K and other people from Laos? Then actually beside the issue of falciparum coming to the last milestone, how about the vivax? What is your top priorities about vivax elimination? Thank you.
From Laos, we have the national strategy plan. According to stratification, we have the two areas. One area like eliminate. We have activity 137, and then the second area like burden reduction area. Like if outbreak or have the case, we respond rapid response. According to our three pillars really meant for National Malaria Control Program. The first, the case management, like early diagnosis and proud treatment. Yes. And second, strong surveillance. If occur the case for the falciparum one case, we respond directly. Like we go to the village to conduct the active case detection for the falciparum one case, right? And for the vivax, 4 case or more than 4 case, we go directly to conduct the early diagnosis. Yes. If we have more case, we respond like at least 7 days. For example, we have the accelerate strategy. We have the reactive drug administration. Yes. When we conduct this activity, we use the TDA, the target drug administration, and then we use the intermittent preventive treatment for last worker, and the last we use the active case fever. Yes, we use this activity for the last mile. Yeah. But for the outbreak, we use only reactive drug administration, only TDA. Yeah, no IPTF, no active fever screening. We really meant for this activity in the National Control Program. Yes. And the last, we provide the long-lasting net and hammock net to the people go to the forest or sleep overnight in the farm, something like that. And also the health education, we go to get the boat. Yes, for us 3 main activity for last mile. Yes.
Thank you for your sharing. And we would love to hear from Dr. Tang. You look so very silent. about the top priorities of Vietnam in the near elimination setting.
Thank you. Yeah. It's a very essential question for Vietnam, also for neighboring country. Now malaria in Indochina is very low. Not only Vietnam but also Laos and Cambodia. We have only some hundred malaria cases, and the top priorities, we would like to clear the hotspot. So, for instance, this year we apply MDA for Lai Châu, and malaria in Lai Châu decreased significantly. So we use MDA in Lai Châu up to now already 4 hours of chloroquine, The other we also concern is the outbreak in Khánh Hòa, in Khánh Vĩnh. But there where Dr. Quang already have a lot of activity. The most important is screening, mass screening, and cheese. And now we also concerning about the new species. That means recently in Khánh Hòa we have the appearance and also the increase of malaria. And the other we also concern is in some Southeast Asia country like Thai, Indo, Malaysia, mainly simian malaria, monkey malaria, knowledge. So we hope maybe with the PCR, with genetic surveillance, maybe we not only focus on fancy or virus, maybe you can do also for malaria and other species. The other we also thinking about maybe we can use the PCR for confirmation of area already malaria eliminated. It's luckily because up to now in Vietnam we have 46 provinces free of malaria, and in 1 month we have 2 more provinces. So total in Vietnam we have 48 provinces malaria free, and up to now no province have the real introduction of malaria, but we still concerning and worry about. So we thinking maybe we can use PCR surveillance to confirm before giving the certificate of malaria surveillance. And the other you already mentioned is asymptomatic malaria. Yeah, it's make the residual malaria in many areas. So yeah, it's very good if we can apply PCR analyze widely. The other thing in Vietnam now we have a lot of malaria importation from Africa. 1/3 of the malaria case come from Africa. Yeah, from Cameroon, from Angola, Congo, Burkina Faso. So these are 1/3 reported, but also many underreported. So I think we also concerned about have the more sensitivity test to detect malaria to control the importation. Yeah, thank you.
Thanks for your sharing, but we have another key important person, Dr. Quang from Quy Nhơn, who lead and respond to many malaria hotspots in the country, and we would love to hear from you.
Nice to meet you all again. On behalf of the leadership of the IPE Quy Nhơn, I would like to share some my comment about the whole country malaria situation in Vietnam. Some points similar to the other country, Laos and Cambodia, but in Vietnam up to now, maybe you know, out of the falciparum and vivac, we are facing with the serious problem malaria, very serious. Every year from the last year up to now, we have more than 300 cases of the problem malaria. Here I think here the new species in Vietnam, because so far we have every year about the 3 or 10K per year, but up to now more than 300K per year. It is very important for us. If we have a new species, that means we have a modified tool to detect. One of the new tool, I think here only the molecular tool, very important for us, because as you know already, current RDT we are using in Vietnam only detect the falciparum and vivax only, and the plasma malaria is always the low parastemia, and therefore Yimsa sometimes mix, sometimes missing about that, and therefore the false negative. And I hope that new tool, especially in the molecular tool, will detect for Khánh Vĩnh district, Khánh Hòa province in Vietnam to detect the own species, where is the co-prevalent 3 species, falci, vivax, and malaria. Here's the first point. The second point, as you know already, I agree with all of your opinion, but you know we are on the way elimination roadmap for the falciparum this year and next year. For falciparum, it seems to be the no recurrent after several months and after several years. But non-falciparum malaria, including the vivax, including the ovale, including the canolicide, and including the malaria in Vietnam at the present. You know, after several months and after several years, they recurrent or relapse, and therefore very difficult to radical cure up till now. And therefore we also need to the molecular tool, especially asymptomatic carrier, asymptomatic malaria, and in Khánh Hòa and in other prevalent in the central highland of Vietnam. And on the other hand, maybe you know whether or not in the previous time or in the last mile of the malaria elimination, when you control the malaria, when you want to elimination of the malaria, you need to have a combined method to control them. That means diagnostic, testing, screening, treatment, and very important with the vector control. Vector control is the one of 3 important pillars. If you forgot them, that means you forgot one the column very important in the malaria control, and in the central highland of Vietnam, and in the especially in the central now, in the Khánh Hòa province. Yeah, and therefore we need to confirm, and we need to investigate by the molecular, and we need to confirm insecticidal resistance by the vector. It is very important. Once again, thank you so much for your attention.
Thanks for Dr. Quang sharing. May I have a follow-up question that in case that we apply the molecular tools to support the certified malaria-free, do you think that the National Malaria Control Program will base on the molecular test that all negative in that province to provide the certification for that place is malaria-free?
Agree with you. Due to the under microscopy and under RDT, I think only the molecular tool will be enhanced for the coverage on the diagnosis of all the species malaria in last mile. It is very important. If we have a submicroscopic and RDT, we forgot I think it's easy to transmission in the community in the near future when we have a secondary vector and the main vector in this area. Yeah.
Thank you very much. And last but not least, we also have the Thailand representative here. Actually, the situation we understand is Thailand is quite different to the three other countries, but we would like to hear from your concern about malaria control and elimination of the countries. Thank you.
Okay. For our country, we have the big problem after we got the COVID, because before of that our malaria situation decreased very well, and after COVID it's come back to increase. However, for the staff and resort, many things is prepared for elimination only. So when we come up again, it's not enough. So we have the problem about the migration, and malaria become the big problem again. So we need to have some certain system or certain method to detect the migration, to detect a symptomatic patient or movement people between the border. After that, we need to protect our malaria-free area from the experiments, and after that we need to have the certain treatment and certain follow-up, because our staff decreased after we think about it, maybe the elimination before the COVID, as staff is decreased. So when malaria is come up again, the staff is not enough to follow up. So we need to come back to strengthen in the system for the treatment and follow up. However, nowadays we have some treatment to try in the local area, like we use the taquinofin for the white malaria to the strengthen in the treatment. We think we can give more drug adherence in our country and try to eliminate in the white. That's the main malaria in the Thailand now. Yeah, I think it's about all of that we need to do in the first priority. Mm-hmm.
Thanks for your sharing. I think we should keep the agenda in schedule. Then I would like to hand back to Oliver, and we hope that we will continue the discussion in the next section. Thank you.
Thank you. This was a great discussion. Thanks for all the viewpoints. It does sound like there's actually a few, some complex things and some simple things where we can really add value to the last mile for the control programs.